Up for?
Yeah. Yeah, you're not kidding. I'll go and see what I can find out.
See?
You can miss me anytime. No, me first.
Got a fan club there.
If it wasn't for the smell of stale alcohol and vomit, I'd actually be flattered.
Yeah, it's Mr. Deadman that I feel sorry for. He's been next to them all night.
Any word on his care home place? We could really use that bed.
Yes, actually, I spoke to the Health and Care Trust, but the one nearby, Wentham Lodge, that one's closing down. Sorry.
What?
Yeah, they're moving the residents to Essex, apparently.
That's where your dad is, isn't it?
Yeah. Yeah, but this is the first I've heard of it.
Why don't you call Sunny Valley? They're only just up the road, and they've got a good reputation for dementia care.
Yeah, and a price tag to match. I can't believe this.
Woo!
Hey, excuse me, that's enough, okay?
I think I've got one cubicle free.
Brilliant, I'll take it.
So, Dr. Nash, Jay Henderson, vulnerable adult with an infected cut on his wrist. News 9, he's got tracking marks up his arm. He's septic. He's in the corridor.
Okay, Ian. Sorry, scrap that. Cubicle 2. Is there a doctor with him?
He's on the list.
Right, I will send Paige your way. In the meantime, prep IV antibiotics and fluids, and can one of you please fill in the bundle because our audit data is not great.
Okay, cool. Thank you.
Right, come on, mate. I know you're slammed, but I'm struggling to get on top of the pen.
Ian, I promise I will get her in here as soon as I can, and in the meantime, I'm going to go and harangue the site team. Okay?
So yeah, the session went really well.
I'm gonna get somebody to come and check on that wind. Can you just give me a second?
Yeah.
Max, do you have a second?
I'm late for my next grilling.
Okay, it's just we're having a problem with beds because the queue's not moving.
And you think I've got a magic solution?
Well, no, I was thinking that maybe we could start something.
Okay, so you've solved it. Great.
Okay, Jay, well, it looks like you do have sepsis.
Sepsis.
Sepsis is basically a nasty infection that causes your heart to beat faster and your blood pressure to be lower.
So it's a good job that we caught it early. How did this actually happen?
It was just some, silly mistake. I swear it won't happen again.
Hey, there's no judgment here.
Right, well, we'll get this cleaned up. We'll put a fresh bandage on it for you, and then we'll get you some IV fluids and antibiotics, okay?
Jay.
I said not to call anyone.
No, I'm nothing to do with me.
What are you doing here?
I'm his legal guardian.
You're my little brother. How did you know where I was?
Guilty as charged.
You're tracking me?
But, come on, Jay, this is only for emergencies, okay? You're in the hospital. What happened?
Why don't you just let...
Long-term residents.
Is that a fall? Oh, it's impossible here!
Can I put my dad on the waiting list, please? It's Ashok Mason.
Hey, you on the phone?
Sorry.
My mum's been queuing for hours, and you're making personal calls.
Okay, so I'm actually on a break, but I'll get a colleague from
Oh,
Stevie,
passing
can
the
you-
buck sounds about right,
All right,
yeah.
okay. What's going on?
My mum, Irene McKenna, in the ambulances.
McKenna. Yeah. She's ambulance 3. She's been triaged. She's on 30-minute obs with a 1-to-1 paramedic. We're hoping to get her to orthopedics as soon as possible, but I've spoken to the site team. We've got no beds.
What, and you think that's good enough?
No, actually, I don't, but I don't have a magic wand, so...
How much longer will she have to wait?
I don't know, but, your mom's not our highest priority right now, which I know to you might sound like a bad thing, but believe me, it isn't. And if you've never experienced this before, count yourself lucky, because this is what it's like now, and we're flat out. What's your name?
It's Ray.
Okay, Ray, the best thing you can do is go. Sit with your mom. We'll get to her, okay? Ryan, change of plan. We need to set up a rapid assessment unit, trying to speed up these ambulance offloads, okay?
My interview. It's all right, sweetheart. Don't worry about stuff like that right now. It's Carla, right?
One rapid assessment team set up outside. Dr. Nash is going to want me on speed dial at this rate.
Well, I'm a sepsis spotting, so looks like you've got competition for nurse of the shift.
How is he?
But patient confidentiality, I'm afraid, if he doesn't want to share information.
Okay, fair enough. I understand. I fuss and it gets too much for him.
Look, it's between the two of you.
But he's got specific needs.
We understand that.
And when Mum died, I said I'd look after him. Can you check his list of medication, just to make sure he's giving you the right information?
Yeah. Right. Mum's gonna kill me. Well, I doubt that very much. But maybe you should give her a call, She's gonna want to know you're safe.
And I am. I'm with you. Stay with me.
Oh.
Please.
Okay. Yeah, let's get the nebulizer.
Lean back for me. Take some nice deep breaths for me.
What happened?
Yeah, that's you sorted.
Right. That's genius.
No, genius would be spotting the symptoms of secondary drowning.
Well, you can't be expected to know everything.
No, but I can't be expected to carry the guilt, Charlie. Irish Catholic upbringing, you know, counts for so much.
Hey, Dr. Nash.
Yeah. Who's this?
I'm gonna get someone to clean up her head. I need to get out of here.
Yeah, that's fine. I'll do it. Had it occurred to you that people might be staring because you look like you've been in a bloodbath? No? I'm sure Stevie's got a change of clothes in her locker if you want to give that a punt.
Any change?